In this video, I'm going to reveal a surprisingly common reason for erectile dysfunction that most doctors rarely mention. Stick to the end, and not only will I reveal what you can do to fix this problem, but also to be able to wake up refreshed and have much more energy in the morning, lose weight, and have your life back again. Hi, I'm Dr. Stephen Park, an ENT surgeon and sleep medicine doctor with a passion for helping you breathe better and sleep better so that you can live more fulfilling lives. You may be asking, what's an ENT surgeon doing talking about erectile dysfunction? Well, on this channel, I talk about all health topics related to sleep, including sexual topics. If you've been with me on this channel for a while, you know that every aspect of your health and wellness is related to sleep, and that includes optimal sexual function for both men and women. On a historical note, during the early days of sleep testing, we placed devices on men's penises to measure rigidity during REM sleep, which is when you dream. That's when all your muscles relax except for your eyeball muscles and your diaphragm so that you can breathe. During this time, the muscles at the base of the penis relaxes as well, leading to an erection. Besides rapid eye movement, an erection in men is one of the hallmarks of the REM sleep stage. Erectile dysfunction, also called ED, seems to be a very common problem these days, looking at all the marketing materials that I'm seeing in print and online. ED happens when a man is not able to get an erection or maintain one during sex. There also seems to be a ton of videos about this topic on YouTube, many with millions of views. I literally spent over 5 hours watching the most popular videos, all with some great explanations on why ED happens and what you can do about it. There are various treatment recommendations on natural options to pills, injections, as well as surgery. Proper diet, exercise, optimal sleep, stress reduction, and avoiding alcohol and smoking are also recommended as well. Yes, good sleep was also mentioned, but it's lumped together with all the various other healthy lifestyle changes. And sleep apnea is also mentioned occasionally, but again, it's implied that it's relatively rare for sleep apnea alone to cause ED. In this video, I'm going to argue that anyone with ED should at least think about checking for sleep apnea, at least before resorting to medical or even surgical therapy. Later on, I'm going to reveal one additional possible way of treating ED, something you won't see anywhere else. These are conservative ideas and concepts that you can think about before you see your doctor. There are a number of natural herbs, vitamins, or supplements that can help with ED, but I'm going to approach this video from a different angle, as you'll see. Now, I do agree that there are a lot of reasons for ED, but I'm going to categorize everything into 3 general areas: psychogenic, iatrogenic, and metabolic. Let's start with psychogenic reasons, which means that it starts with emotional or psychological origins. Just like if you're not hungry after having a fight, you won't have any sexual desire and arousal if you're under any stress. You can imagine that there are many different ways that this can happen. This is a huge topic that I'll leave to the psychology experts to explain. Iatrogenic means that it's caused by medications, drug use, or even after surgery, such as after prostate surgery. There is a long list of medications that can also cause ED, including some high blood pressure medications, corticosteroids, recreational drugs, antidepressants, antipsychotics, and anti-seizure medications. If you want to find specific medication names, I'll place a link to a list below. It's a long list with drugs from many categories, so I strongly recommend going through it if you suffer from ED. If you find any of your medications on the list, see your doctor about finding an alternative. Needless to say, it's important to address psychogenic and iatrogenic reasons for ED alongside the third most common reason, which is metabolic. Now, when I say metabolic, I mean various health conditions related to prolonged insulin and leptin resistance, the end result being central belly fat, diabetes, cardiovascular disease, sleep apnea, dementia, and even cancer. This will include about 70% of all men with ED. And overall, over 50% of men with diabetes are found to have ED. And obese men have a 30% higher chance of having ED. And in men with sleep apnea, the rate of ED ranges from 50 to 64%. Looking at these numbers, it's clear that ED is one of many potential consequences of metabolic disorders. This is a scary picture since in the United States, about 42% are obese and another 32% are overweight, meaning that almost 3/4 of all Americans are either obese or overweight, measured by a BMI greater than 25. Another recent study from Tufts University found that only 7% of the US population is metabolically healthy, based on measurements of blood pressure, blood glucose levels, cholesterol, BMI, and whether or not there was heart disease. An important point I want to make here is to say that sleep apnea doesn't cause ED, and ED doesn't cause sleep apnea. Metabolic disturbances are what mainly cause sleep apnea and ED. Both these conditions are the downstream end results of metabolic disease. but in many cases, sleep apnea may tip you over the edge, triggering ED. One of the great pleasures of successfully treating patients with obstructive sleep apnea over the past 20 years is the feedback from men on how much their sex lives have improved. In retrospect, this was likely only a temporary effect since I didn't address the underlying metabolic and cardiovascular risk factors that cause ED to begin with. Yes, sleep apnea treatment, whether it was CPAP, dental devices, or surgery, did help with sleep quality, but I assume that any other potential cardiovascular diseases should be handled by their PCPs or cardiologists. So how does poor sleep affect sexual function in general, and more specifically, your erections? As with all areas of your body and your organs, it's controlled by the two halves of your autonomic nervous system, the sympathetic or the fight or flight response, and the parasympathetic nervous system, which is what controls digestion and reproduction. Sexual arousal is activated by the parasympathetic nervous system, leading to erections in men and vaginal lubrication in women. An orgasm is activated by the sympathetic nervous system. So you can imagine if your mind is distracted or worried or anxious, the parasympathetic nerves won't work as well. Now, with long-standing poor metabolic health, you have much higher levels of chronic stress states and lower levels of relaxation or parasympathetic response. What happens in the heart with heart disease also happens to the penile vessels. It gets stiffer and has a hard time relaxing. There are many different pathways on how this happens, but one familiar concept is related to nitric oxide, which is the molecule that blood vessels make that relaxes the smooth muscles. And in particular, nitric oxide production is a major step to relax a smooth muscle in the penis to cause erections. So not too surprisingly, short sleep duration is found to damage endothelial function by lowering nitric oxide. This is called endothelial dysfunction. And it's no surprise that common drugs for ED like Viagra work by raising nitric oxide levels in the penis by blocking the enzyme that degrades nitric oxide. The problem is that it also raises nitric oxide levels throughout your entire body, which is what can lead to complications. Furthermore, chronic long-standing stress responses that lead to overall metabolic disturbances were found to cause endocrine and hormonal disruptions, ultimately with lower testosterone levels. In this study on mice, major sleep deprivation disrupted the hypothalamic pituitary gonadal axis, with lower luteinizing hormone and testosterone levels, and much higher cortisol levels. Inside the penile tissues, the endothelial nitric oxide synthase levels were found to be lower. This means that there were lower amounts of nitric oxide to relax the smooth muscles in the penis, which can prevent mousy erections. And studies are showing that people with sleep apnea with documented endothelial dysfunction can have it reversed after being on CPAP. Now, if you look at men who presented their doctor with ED, about 65% are found to have sleep apnea. On the flip side, about 64% of men with sleep apnea are found to have ED. So there's a significant overlap between the two. Specifically for men with sleep apnea, the severity of ED was found to be related to lower oxygen levels. And if you treat these men with CPAP, anywhere from 1/3 to 3/4 had their ED resolve. As expected, response to CPAP was related to how well they tolerated CPAP. And it's been well documented that men with sleep apnea have much lower levels of testosterone. However, applying CPAP didn't raise testosterone levels. It's thought that lower testosterone is rather due to obesity and not directly from sleep apnea. So as you can see, any significant sleep deprivation or sleep apnea can disturb optimal sexual function in men. And while we're all programmed to think that the cure to this is a small blue pill, this should be your last resort. I have to say that for many people with ED, it's never going to be only one lifestyle modification, hack, or supplement that's going to help. Even if it does work, it's only temporary. This is why it's important to layer on many levels of intervention, from the most conservative moving upwards to more aggressive options. There are tons of great tips, supplements, breathing techniques, and relaxation methods that are out there for ED. What I'm going to emphasize here is to prioritize optimal sleep and metabolic well-being. And since such a high number of men with ED are likely to have sleep apnea, it's important to get tested. Even if you don't fit the typical older, heavy-set snoring man profile, you can still have significant sleep apnea. And if you're found to have sleep apnea, work with your sleep doctor, sleep dentist, or ENT to take care of your snoring and sleep apnea. At the same time, focus on optimizing your sleep quantity and quality. We know that the vast majority of Americans are not getting enough hours of sleep. So if this is you, try to get at least 7 hours of sleep. Go to bed and wake up at regular times, 7 days a week. Avoid any electronic screens, phones, or computers within 2 to 3 hours of bedtime. Avoid eating or snacking within 3 to 4 hours of bedtime as well. These few tips alone will help you to lose weight if you have any to lose. Now let's talk about your metabolic problem, especially if you're overweight. As I mentioned before, without good sleep quality, it will be hard to lose weight. But when it comes to weight loss, it's been shown that what you eat accounts for about 80% of weight loss, and only 10% is from exercise. This is why it's so important to focus on what to eat and less on how much to eat. Obviously, the common recommendation by doctors to eat less and move more doesn't work, especially in the United States. But the bottom line is that if you're overweight or obese, losing significant weight will most likely help or resolve your ED significantly. And even if you're relatively skinny, you can still benefit from becoming metabolically healthy, cardiovascular-wise. So for a short-term solution, you can try all the various solutions out there. But if you want to address this problem more on a permanent level by addressing the root cause, then it's important to address both sides of the coin, which is metabolic dysfunction and poor sleep. So here are 10 basic steps you can start with. Number 1, as I mentioned, prioritize sleep. Try to sleep at least 7 hours every night, every day of the week. Get tested for sleep apnea and get it treated. I have to warn you that although many people do well with sleep apnea treatment options, some of you may struggle. That's why it's important not to give up and try different options or see different professionals. If you've already been diagnosed with sleep apnea and struggle with CPAP, check out my book, Totally CPAP, a sleep physician's guide to restoring your sleep and reclaiming your life, for practical tips and solutions on ways to get CPAP working for you. Another important tip for better sleep is to avoid eating or snacking within 3 to 4 hours of bedtime. Having any additional juices after eating will make it easier to come up as reflux into your throat and nose, causing more obstructed breathing. Number 2, cut down significantly on your intake of carbohydrates. This comes mainly from bread and pasta. And these food products get converted to glucose quickly, which raises your insulin levels, one of the major drivers of prediabetes and diabetes, as well as the obesity epidemic. Number 3, cut out all sugar and processed foods. This is one of the main reasons for creating high levels of insulin, which can lead to metabolic syndrome. I know it's easier said than done, but it is possible. Once you start to research this, you'll be shocked at how much sugar and fake alternatives are in all your foods. Rather than trying to find an alternative to sugar, just skip it altogether. Cut out all sugary drinks, juices, and shakes. One of the best ways to avoid sugar cravings or hunger pains is to eat a lot more healthy fatty foods. This includes eggs, bacon, butter, and red meat. If you minimize insulin production by cutting down on your carbohydrates, then your body will process the fat and proteins that you eat much better, and you'll lose more weight. It's also been shown that the better you sleep, the less hungry you'll be for sugary or starchy foods. Number 4, if you drink alcohol more than occasionally, cut down significantly. And no more drinks before bedtime. Alcohol may help you sleep better, but by relaxing your muscles, you have more apneas and suffer worse sleep, along with more acid reflux. Alcohol also adds many more calories, as well as damaging your liver. Number 5, avoid all electronic screens 2 to 3 hours before bedtime. If you have to work, use the blue light blocking feature on your computer or device. But if you're watching typical entertainment on TV, cable, or online, it tends to be either stimulating or disturbing. Instead, read a book, meditate, stretch, or just have a conversation with your loved one. Blue light from these screens will block your sleep hormone, melatonin. Besides making you sleepy, melatonin also lowers stomach juice production, lowers insulin, and tightens your lower esophageal sphincter, so you'll have less reflux. Number 6, make sure you're eating adequate sources of food with iron. I'm making this statement because there are studies that show that low iron is associated with lower testosterone, and low iron is known to be associated with restless leg syndrome, a common sleep disorder. It's important to note that iron from red meat is much more bioavailable, from about 15 to 35%, whereas from plant-based foods, it's usually much less than 10%. Plus, if you eat a standard American diet or a SAD diet, it's likely laced with lots of glyphosate, which is the most commonly used herbicide in most of our crops. One of the key properties of glyphosate is that it binds essential 2+ cation minerals such as iron, zinc, manganese, and calcium. This is why it's important to eat as cleanly and organically as possible. Stay away from packaged or processed foods. Try to cook at home as much as possible. Number 7, look for and get rid of anything that lowers testosterone levels, especially what are called xeno-estrogens, which are found in many plastics and various personal care products. We know that sperm counts and testosterone levels have been plummeting over the past few decades. Go through all your cleaning solutions, personal care products, and kitchen products to look for possible xenoestrogens and look for alternatives. There are many online resources that you can use. Along the way, you'll be getting educated about many other dangerous chemicals and toxins, which I don't have time to talk about in this video. Number 8, check your vitamin D level. Believe it or not, it's been shown that there's a strong association between ED and low vitamin D levels. In this prospective 12-month study, giving vitamin D significantly improved ED scores, raised testosterone levels, and significantly lowered levels of estradiol, parathyroid hormone, hemoglobin A1C, and BMI. Number 9, it's been found that lower melatonin levels are found in men with ED. I couldn't find any studies using melatonin in human males with ED, but there are lots of studies showing success in rats. It's thought that melatonin works through its antioxidant properties. And as I mentioned before in a previous video, near-infrared light produces intracellular melatonin in the mitochondria. You can always experiment with small doses of melatonin, but try to make it more natural by avoiding lights at night and exposing yourself more to sunlight during the day. And lastly, for number 10, I talked about how the vessels in the penis are hardened in men with metabolic syndrome, and that they also have what's called endothelial dysfunction, being unable to release nitric oxide from the vessel linings to relax the sphincter muscle, preventing erections. I ran across an interesting study looking at diabetic rats with ED. After being treated with near-infrared laser therapy, the authors wrote, quote, "Near-infrared laser irradiation activated mitochondria, improved oxidative stress, repaired structural damage to penile corpus cavernosum tissue, and improved erectile dysfunction in diabetes mellitus rats." Obviously, humans aren't rats, but our physiology is the same. There are countless books, YouTube videos, and anecdotal reports of success using near-infrared light therapy for a variety of health problems, including ED. Personally, I've been using near-infrared light for almost a year for various issues. For example, to speed recovery after cuts or injuries, muscle soreness, and to improve digestion. It can't hurt to try it. There are many different options for near-infrared therapy, from small handheld devices to 3D full-body options. I'll place a link to the one brand I used in the description area below. I also did a video about this called Melatonin's Surprising Health Benefit, Not Related to Sleep. You can find the link below as well. So if you're suffering from ED, rather than looking for that one hack pill or supplement to help, focus mainly on your metabolic health and your sleep quality. The 10 items I listed are only the start. Once you start taking responsibility for your own health, I'm confident that your overall quality of life will improve dramatically. Not only will your ED improve or go away, but you'll feel much better during the day with much more energy, and many of your other health problems will get better as well, not to mention the added weight loss. I hope you found this video helpful. Please remember to like and subscribe to my channel so that more people can find this information. Please help me to get to the 50,000 subscriber mark. If you're interested in a more customized approach for your sleep or health in general, consider working with me through my virtual coaching service. Click up here to find out more information or to register. Until next time, this is Dr. Stephen Park.